women's health is nation's wealth, really, because people are open to listening to advice on wellness and preventive care. We find every single year 4 to 5 million Indian women having high sugars in their pregnancy, and that's a large number. Now, women have started asking the doctors, you haven't tested my sugar in pregnancy, and that's awareness. But even if you succeed and get at 70% of our young girls, 9 to 14 years, receiving one shot of this HPV vaccine, the next 20 years, we will be averting 5.6 million deaths. Pregnancy by choice and not by chance is another major slogan. Women were given to understand that they have to just go through this phase of life, come what may, they have to grin and bear it, and then nobody is anyway paying any attention, and they think that menopausal mood swings are just a part of her crankiness, because violence against doctors is also becoming very, very much in the foreground now.
In medical school, ma'am, were you first bencher or last bencher?
You know, the things that I love to do, including this podcast.
What would you say you would have done if you hadn't chosen medicine? Hi, Dr. Hema Divakar. We're really excited to have you here with us on another episode of the Humans of Medicine podcast. And I know how packed your schedule is. So thank you so much for sparing some time to be here with us today.
Hi, Sandhya. The pleasure is equally mine, because when you ask me how are you feeling today, I'm feeling happy and excited and very proud of the generation next, like you guys who have put up the Humans of Medicine and then breaking the silos, doing something which is very unique and very different. I really, really appreciate that you have percolated into the technology space and connecting with health, and I'm excited to do a lot more with you.
Thank you so much, ma'am. That's very encouraging coming from you, especially because we know that you're spearheading a positive movement of change in the healthcare ecosystem for women, not just in India, but globally. How did you accomplish all this? It's brilliant.
Okay, only when I sit down for a reflection or interviews with you guys, then I say, oh, this has all gone behind me. I have really done it. Otherwise, there's really no time to pause and look back on what has been done. And the policy is that, just go with the flow and do whatever you can with whatever you have. That's called the bird in hand principle. Don't look for more, some unique opportunities to come by. With whatever you have, you get started, do the best you can, and then the things will evolve in the direction you want to be. So that is being a diehard optimist and a positive, look at instilling the hope in everybody that, hey guys, this is all we have, and let's see what best we can do. That's called the Indian Jugaad, because what is feasible, what is pragmatic, what is practical, we jump into action, because I always believe that to win, you have to begin, and then you evolve, learning your lessons and making course correction and moving the needle forward in the healthcare ecosystem. When it comes to women's health, Sandhya, there is a lot more to it than what a doctor can do in terms of the technical or the medical aspects that you need to deal with a person, because it's quite different for girls and women, because it is shrouded with many other social, economic, and educational issues, because oftentimes she doesn't have the right to decide for herself, and that is the primary major setback. And education is a thing which empowers her to earn for herself and to make decisions for herself, of course in coordination with the family, but at least she has a choice. So that is something which is very unique to girls and women, who are dictated oftentimes by the society of what their gender stereotype should be or their role should be. So the circumstance which is social and economical also impacts on the gender bias and the difference that we have, which is quite glaring at times, and women have to really work more harder in the same circumstance and the same opportunity to prove themselves. So looking beyond the medical aspects of what the patient has come with, we need to a little bit extend our empathy and build her confidence to do more things for herself as an individual as well.
Right, I totally agree, and that's and you've literally walked the talk, because you said you have to win, you have to begin, and you started Artist for Her as the founder and the managing director of this beautiful skill transfer training institute. Where did it all start? How did you chance upon it, and can you tell us more about it?
Okay, the first time I heard the word skill transfer was way back in 2003 when a team from Johns Hopkins had come, and then they said, you involve some postgraduate students, let us set up some workstations and we want to skill them, and this is an entire program of skill transfer. I said, oh, this really bridges the gap between knowing and doing, because you have a lot of knowledge, you read a lot on how to drive a car, but unless you are actually behind the wheel and get started, you're not good enough. So hands-on exercises and really the skilling aspect was very, very appealing. And we said that in the Asian community, in the whole of South Asian region especially, we don't have much opportunities to skill when we train abroad, because we're just observers and we're standing at the corner of the room seeing what they're doing. But as I said, that's not good enough. So I said we must do something about the skill transfer for the Asian region. So I was buzzing around with one thought of capacity building, that is training of all our frontline healthcare providers and medicos to skill themselves, and those who are already in the system to upskill them to do better. And at the same time, I said we don't know the trends and what's going on, because in most of the circumstances, we don't have data from India and we don't have data from low middle income countries. It's just a perception of few leaders that they think this is what the people need or this is what is happening. So the research part of it, as in implementation research, when we think upon an idea, how do you translate it into action? And when you start implementing, there are unknown perspectives which you will stumble upon, and then I always still am wonderstruck with the awe of, I had never thought about this aspect, of what barriers or challenges we may face when we embark on any research. The research is not typically a research, but it is how to implement what is already known, which needs to be done very, very differently in many parts of our own country, and also gather the knowledge, attitude, and practices, KAP, what's called, of the community themselves. Because it may be our perception that they know it all, or they attitudes are this and they can practice it, but that may not be the ground reality. So then when we collaged all this, we said, what do we need in the Asian region? We need this kind of research, and we need the training or the capacity building. So then in 2007, I was just, toying with the words, and we said, oh, this can be called Asian Research and Training Institute for Skill Transfer. And it read as A.R.T.I.S.T, Artist. I said, oh, this is a beautiful thing. And everybody started asking, where is this institute? I said, it's in my head. This is a virtual institute. It's here, and this will do a lot, many more things. The art of artist is A, for advocacy or awareness and empowering the community to know what their rights are and what they should seek. R is for research, and T is for training. The art of artist is as in the Center of Skill Gurukul, we call it, established in 2007, and we are on and on and on with one of our major flagship projects being ABCDE. A for anemia and adolescent care, B for building contraceptive choices, C for cervical cancer, kill it before it kills you, D for diabetes, the bitter truth about the sweet disease, and E for emergency care. And E also means etc., because we have many more things to tackle as we go along, but the ABCDE is the base for many, many things that we do.
So can you tell us a little more about GDM, gestational diabetes, and what is the state right now in our country and abroad, and how aware are women about what it is and what causes GDM, and what are the implications on mother and child?
See, what really happened, the GDM story goes like this. 35 years back, we used to maybe have, when we test one pregnant patient for her levels of sugar, if we do test it based on some indications that we had way back there, we may have had 1 or 2 patients in the whole year who have high sugars and who need to be referred to a diabetologist, especially. So we used to not bother too much, because 1 or 2 patients you can always refer and then get the right advice on that aspect of the rest of the pregnancy we are managing. But sugar management is from the concerned specialist. So we said that's not our forte, and let's not meddle with that. So let them do their job and we will take care of the pregnancy part of it. But as the years evolved, there was a large study from Chennai who said you test all the women and Asians have 11 times more incidence of having gestational diabetes, and the incidence is not a meager 1 or 2% that you think. It's about 12 to 14%. That was a Chennai study. And then when I looked into it and then I started talking about it in the forums, they said, oh, you South Indians, you are rice eaters, and oh, that is why maybe in Chennai it is so high, but in south of India it may be high. But no, this is not a problem in our part of the country, which is our part of the country, is our part of the world, because the country is so big. So they said, no, it is not. Then, the process evolved that we must ensure test every single pregnant woman in the country, and there are 30 million pregnancies every year. And when we do test them, it's called the universal testing with the glucose challenge, and we find every single year 4 to 5 million Indian women having high sugars in their pregnancy, and that's a large number. So we said we have 1,500 diabetologists, maybe 5,000 physicians, and in smaller towns there are none. So we have to take the responsibility for caring for the women with high sugars, and for the first time in the world, we collaborated with the World Diabetic Foundation and instituted a certification course for how to render an OBGYN confident and competent, skill transfer, and empower her to deal with these patients, primarily for early detection, testing, the nutrition management, the lifestyle advice, the monitoring of sugars, and the oral tablets. Only the last few, who remain uncontrolled, who have to have the insulin, will then be referred to the specialist, and those numbers work. So several thousand, more than 20,000 obstetricians took this course. They all recognize that this is the need, and then we influence the government policy. And India is one of the South Asian countries serving as a role model for the recommendations of how a woman in pregnancy has to be tested and treated for high sugar. So that is, in the government recommendation, and other countries, we are happy to say they're adapting it and recognizing the value for it. So that is about gestational diabetes. And slowly, when the thought process evolved, we said women's health is nation's wealth, really, because if you don't handle her sugars, the baby should never know that mom has the sugars. You have to do whatever it takes to get her sugars to normal, so the baby is not growing in an environment of high sugars. If it grows in an environment of high sugars, it will be genetically programmed to become an early onset diabetes in its adult life and the childhood obesity. And it has long-term implications. Even these women will go on to type 2 diabetes. Just in, if she's 25, she's delivered today and nobody has even bothered to give her a long-term advice. By 28, she's a full-blown diabetic. It started in pregnancy and it has grown over her. And by the time she gets to 40, she either has a cardiovascular accident or with the complications of diabetes, etc. So how the intergenerational transfer. So then this now has become a very, very big and central issue for the government, for the globe, and to tackle the volumes of these many women progressing into a state of NCD, or non-communicable diseases, as we call it. India is only second to China in the numbers of diabetic men and women that we have in our country, more than 100 million, it's an overwhelming number. And Sandhya, you can quite relate to the fact that every family now in India has 1 or 2 with high sugars. And just imagine the impact on their economies, because they have to get tested, they have to be treated long term, and the spends that they do whether it's for groceries or their other kind of shopping, it's also a big medical list. So this is a real tsunami, and the sooner we tackle, the better it will be. And it has to start from the adolescent age, where the lifestyle changes have to, roll in and kickstart from that point, so that by the time they get to the reproductive age, they're of a proper weight and they're aware of these tests and they're aware of how they have to manage their diet. So hopefully, we will be gifting good health to the generation next if every mother in the future takes care of these aspects of high sugars and high BPs during her pregnancy, so that the children are programmed for the next generation in a better way. So this is a complex situation, but it can be explained quite simply to the population at large, so that their health is in their hands is something that they must be aware of. So even today, we are still struggling with remote areas not being able to reach the specialist doctor. But now, as you can see, the technology has come to our rescue, because the video consultations with the specialist for any or many such patients in the last mile can easily be offered. Their day-to-day diet counseling, motivation, whatever else you want to do with them, they want to send us the sugar reports at whatever frequency, everything can be handled through technology platforms. So that is where we are seeing a hope for getting our control on this huge menace that is striking us hard.
And awareness in the community by and large, which you try to bridge that gap of awareness by digitization, which is great in itself. And also,
in some parts of the country, the women have started asking the doctors, you haven't tested my sugar in pregnancy, and that's awareness. So that is that demand generation is so crucial, because I think every girl, every woman should know what she should be asking for. Even if the medical community, as of now, because of time constraints and human resource constraints, there are some gaps in delivering the quality care. But if you're asked, then there is no looking back. They have to deliver.
Absolutely. Yes, you're empowering everybody, which is great. And coming to another important topic that I think people do lack awareness on is the HPV vaccine, cervical cancer. And also, can you tell us something about the age group that is recommended to take this vaccine?
Sandhya, to start with, many girls and women are not aware of what cervix is in the first place, because it's a hidden organ. And everybody knows about uterus. So, okay, the child, it's a womb, and then there's a pregnancy happens there. But the cervix, as in being the neck of the uterus, because there was a open forum where we were discussing, and I just asked, do you know what the cervix is? Yes, doctor, I know. I had cervical spondylitis. Okay, so because I wear heel chappals, and afterwards I stopped, and they did it. So cervix is actually the neck. So she is right in referring to the neck and had the cervical spondylitis, but that's a more common terminology. So I said, okay, we are referring to the neck of the uterus. So from there, you have to begin, guiding them. So nobody can see, nobody knows, and it's a women-centric issue of cervical cancer, which is a dreaded disease. Okay, and just imagine the fascinating breakthrough in science about the know-how that HPV is the single virus which is responsible for the cervical cancer, and therefore, just like polio virus, you destroy it by giving the polio vaccine, eliminated polio from the country. The same way, the HPV vaccine or the cervical cancer vaccine will eliminate the HPV virus. And the dream is that the cervical cancer should be a non-issue. That's where we have to reach. And the WHO has given us a slogan of 90-70-90. That is 90% of our girls between 9 and 14 should receive at least a single dose of the vaccine, which is so doable. And I think the government is going to take that on board very soon. And though in private, we are already doing now, there are cost constraints, but the volumes will increase, local manufacturers will come in, and then this should be made available at least for all the outgoing school students and school dropouts also. Now there are many mechanisms where we can, because we are aiming at 90. But even if you succeed and get at 70% of our young girls, 9 to 14 years, receiving one shot of this HPV vaccine, the next 20 years, we will be averting 5.6 million deaths. That is the scale, importance of giving this vaccine. And we are now beginning to encash on this movement of the COVID vaccine being an adult vaccination, and everybody is in mind is running towards preventive care. What is it? How can we do? Doctor, are there any other new vaccines available? So now that they have started asking that, they're in the right frame of mind to accept the advice on the cervical cancer vaccine. So that's a must. However, the 9 to 14 age group, if we have missed that out, the catch-up vaccine, what we call, can be given right until the age of 45 years. Because potentially, until that age, if the HPV enters the body and lodges there in the cervix for maybe more than a decade, then the cells will grow into cancerous cells. So you have the multiple opportunities at any. She may be coming to fix a menstrual problem, but you can always talk to her about the cervix, the cervical cancer, the availability of the cervical cancer vaccine. Does she have any daughters? Are they vaccinated? And do the school programs, this, that, and the other. So there's a lot of scope. So 90% vaccinated at the right age group, 70% early detected, because now we can directly test the HPV virus, unlike in the past. And that is a test which is catching on even for self-care. Like COVID test, you do it at home. Urine pregnancy test, you do it at home. So you can do the HPV test also at home. The self-care kits are now made in India, and there's a lot happening around that to build awareness about the availability of this and how once in 5 years the women in the reproductive age group can test themselves for it. So that's a great movement that we are launching. So screen the mother by way of HPV testing and vaccinate the daughter. So this is a mother-daughter initiative. So in combination, the whole family should be covered with that. So 90 is vaccination, 70 is this HPV testing and early detection, and the last 90 is, as early as possible, the early treatment for all of those who are in advanced stages of cancer. And now with Ayushman Bharat being escalated, there are many women now who are availing for under the cover of Ayushman Bharat, the cervical cancer treatment. But we feel that double the number of women can be treated at half the cost if detected early, and they'll have a very good quality of life if the intervention is done early. And of course, we are foreseeing that maybe in another 50 years from now, if all our girls are vaccinated, the card of immunization at birth says the last of the vaccine that the mom should give the daughter is cervical cancer vaccine. And if the whole implementation program of the vaccination happens, we will really be able to eliminate the HPV from the country itself. So that's the goal, which many affluent countries are already at it. But we should not we should not lag far behind. India was one of the last countries to eliminate polio. We could have done better, we could have gone faster, and now we should not really take those many years as a developing country. We should be proud of the fact that we have fast-tracked, we have managed to implement the vaccination program and got the next generation to a good state of health.
And even one dose of the vaccine has this kind of efficacy.
So countries like Bangladesh have taken one dose, single dose, and it's in the National Immunization Program. We are waiting for our government to announce something similar very soon. So I think that will give a lot of strength. As it is from 2024, they want to roll it out in 11 states. But as you know, the country is big. It takes time to get people aware. But the girls are wise. The families, even in the villages, have their great native wisdom, and there is no hesitancy if you explain to them in the manner that it should be. So they are more aware and proactive and wanting to take this. So it is just the gap that we have to bridge, that we should be wanting to give it to them as ASAP.
Right. So I think you are doing a lot of awareness around this, even in schools.
Yes.
Are you running campaigns in schools
yeah,
as well?
because we run, typically we don't want to handle one vertical only of HPV. So we run a program called Health and Hygiene in schools, many schools. We used to track behind the ISKCON van, which goes with the midday school meal to various schools. So it's 85,000 children, 1 lakh children in the whole year. So there are so many schools network which are available to us, where we go and do the health and hygiene program, which again has the anemia care, the nutrition, the sanitation and hygiene, the menstrual health, and what they should be aware of. And we are beginning to get many more questions about sexual activity and contraception, even in girls, fifth, sixth standard, as early as that, because they are exposed to the digital platforms and they are curious. And then it is a good opportunity for us to guide them in the manner that they should be, because they have no other go-to person. So we are thinking of developing, there are already apps available, but maybe we should facilitate in a more user-friendly way, confidentiality and anonymity being maintained, because the more empowered they are with the know-how of how responsible they have to behave, I think it will go a long way in at least reducing the 15 million abortions which happen in our country every year with unintended pregnancies and lack of use of contraception. So it's a mix of everything, inclusive of the awareness of the HPV vaccine, where almost all the schools, the teachers, the parents, and the girls themselves, the awareness is somewhere between 0 to 4%. That's all. So we have a long way to go, but I think it is picking up because people are open to listening to advice on wellness and preventive care. So as I said, this is our moment to encash, and we should do better than what we're already doing. But each one is our mantra. So we tell all the girls that you have to be the ambassadors. Every day you tell just one person, HPV vaccine is available, go take it.
It's good to know that, the ones who haven't taken it, they still can till the age of 45.
Absolutely.
So that's great. And coming to, you spoke about sexual health and wellness. Are doctors comfortable about talking about that? Have things changed compared to how they used to be?
We did another publication on where do the youth community, where do they seek their advice from? Okay. Then 85% of them are from the internet. Okay. And about 5 to 7% are from their friends and peer group. And the last 5%, parents and or doctors, because they are not forthcoming to the doctors, and they don't want to stray into a clinic, for example, to check on few of the doubts they may have, and their major source is somebody who is anonymous who can tell them. So we need to be in that space, Sandhya, because the authentic information, the non-judgmental kind of counseling, and then reassuring them and building their confidence as to what it cannot be pushed under the carpet. So typically in a consultation room, we are trying to push things under the carpet, and also we don't know whether the girl who has come with her mother, for example, she doesn't open up and say the things that she wants to say, and many times the mothers are overpowering. They never allow the girl to talk and they want to say it all, and that also happens. And sometimes when they come into the hospital, they may see a friend or a relative, hey, why are you here? That kind of a question. So they are often hesitant to come. So as far as the doctors go, they don't proactively raise this because the target of the adolescent community is not really available to us. We have to reach out to them in many more ways, which can, again, I'm coming back to the technology part of it, which can be done. And as it is, that's the familiar platform that they want to go to. Yeah, so we might as well facilitate that a little more strongly than expecting them to come for a one-on-one discussion into our chambers. So some of the senior doctors are still very, very hesitant to ask the question, even for a 20-year-old, 22-year-old, are you sexually active? That question doesn't come with ease. Even for us to begin with, it was difficult because we thought, what would be the response of the girls or of that age group who are career women? Typically they are into sexual activity, but they are not married. Okay, so for a question like this for an unmarried was an unknown thing in the past, but now it's the most common question, leading question that we do ask. So even we've changed our mindset and temperament because we know the ground reality that this is happening and they need advice. So and the girls are much more for they may teach you a thing or two. Sure.
Yes, I'm sure. Yeah, that brings me to the question on fertility, because I think this is also something that a lot of us are just now thinking about and talking about a lot more than we used to. What are your thoughts on this? What are the trends around fertility preservation, as we call it?
Actually, there's now a fertility preservation society that has been established, and they're doing a lot of work on awareness building on this, because there's a small segment which is opting for this, and some of them are made to feel this may not be the right thing to do because not many more. But the trends of the demand, growing demand for this is definitely there, especially in the metros, because most of the girls do not want to interrupt their career or the study. They don't know what may happen in future. They've also heard that the Asians, the ovarian aging is pretty much more accelerated than the rest of the world. So they don't want to touch 35 and then regret that they've lost time, but they don't want to conceive when the time is not right. At least they have a choice for themselves because they're educated, they're empowered, and they're earning for themselves. That is the key point, because pregnancy by choice and not by chance is another major slogan. But it was just a slogan so far. But now the girls are determined to really have the pregnancy by choice. And of course, there'll be a lot of pressure and influence, not only from their immediate family, but also the societies. And sometimes, feeling of guilt that they are not doing the right things at the right time. All of these make things very complex, though I would rather very strongly say that the fertility preservation mechanisms have improved a lot, and it may be a wise thing to do, because when you say you don't know what tomorrow brings, then this is one of the, it's like a fixed deposit in a bank. It's there. It's safe. Okay.
Yes.
So at least your mind is not hassled
Yeah.
when you move ahead, because you have something to fall back on. So I think that attitude should be encouraged. And another major reason why the fertility preservation is now the topic for the season is because many young girls are detected with cancer, and when they have to undergo cancer therapy and also the chemotherapy, we know that the ovaries are fired, and that's why there's always a crosstalk between the oncologist, the cancer specialist, to the gynecologist as to how they would preserve the eggs and how they would secure fertility, because the chances for survival of this young girl is much more better than what it was ever before.
Right, I agree. In the sense, we also talk about the biological clock that keeps ticking, and what I've read and understood is that it's better that you try fertility preservation, cryopreservation when you're younger, but then those people who miss the bus, who are not in their 20s, who are now probably in their 30s, is it still okay for them? Can they still go ahead? What about the ones in their 40s? Is it still recommended in terms of the pool that you get, and how many eggs actually make it through the process and all of that?
It is very individualized actually, because the chronological age and the ovarian age may not be in synchrony. A girl may be 25, but her ovary may be behaving as if it's 45. It's already an aging ovary. Whereas she may be 45, but the ovary is like, her fertility potential is great because the ovaries are still at it. So that is the kind of evaluation that you need to do. And in general, in principle, earlier the better, because this mismatch can be there in many women. But in general, the younger the age group, the better are the chances of you yielding good quality eggs for freezing.
Absolutely. Thank you for clearing that, ma'am, because usually that's one of those misty areas which people are not fully, the gray areas that we don't know about. Back of the day, just to track your periods and your fertility, FemTech was started, right? It just, everything started there with period tracking. So can you tell us, because you are very active in this area, and you're very passionate about it as well, because it does bridge gaps in healthcare. It helps reach more people with the right information. So can you tell us about your experience with FemTech, and what are any new ventures that you're embarking on, or what's happening there?
Actually, I've been hooked on very passionately to technology as such in general, because there is so much more you can do, and the space where you can reach every girl, every woman, everywhere, every time, there's potentially a huge opportunity with the use of technology. So, but today's day and age, what is happening is the FemTech is, again, people have recognized that feminine technology, that is the healthcare revolution, innovations, and the new, inventions for women's healthcare, which is a big Pandora's box in itself, through technology can do a great lot. So the very first, time this word was coined as femtech was by Ida, who has produced an app called the Clue, which is the menstrual tracker. And that probably many such initiatives have opened up the people's mind that talking about menstruation or expressing their problems, or they're in a community talking about it, and then the use of menstrual cups, for example, which has got propagated through the technology platform rather than by the doctors. So many of these things have happened, and now, uh, you know 35 years back, when we used to ask the key question in medical practice, as you know, when a woman comes, when was your last menstrual period? Then she'll look up, down, everywhere, and then she'll say, oh, maybe Deepavali time I had. She'll connect it to some festivals, and then she'll look at her husband, and husband has made a note somewhere, as bad, as bad as that. And many times we used to put a question mark there. We don't know when her last periods are, and then we can't calculate this, that, and the other. That was the usual scenario. But we have really, really come a long way. Any girl today, I ask, she'll just open up a mobile and then show all the periods tracking, and then the moods during her period, and then the pattern of the period. Everything is over there ready, available to us, and we hardly have to ask any questions. So that, what you note, what you assess, what you audit itself makes you feel better about your own scores of improvement, or you're in terms with reality of what you're dealing with, etc. So menstrual tracking apps, it may have started as a, as a thing to show off in the young community, but it is really, really useful for many reasons. And then also there are certain highlights around the premenstrual symptoms and what she could eat or not eat, and what kind of exercises she can do, not do, and the challenges that they take for themselves to improve their body mass index, and then the kind of recipes that they share on these. It's a very engaging and interesting world for the community. And as you move further in your life, even perimenopausal, menopause, lots of apps are there for women in that age group who learn a lot about themselves. So I think the key thread which runs through all this is awareness and educating them, for which typically the doctors have no time. And I think it's a great thing that the technology is doing. And even if we don't ask, they will say, no, ovulation tracking I've done, and this is the day of ovulation. As I told you, they give the doctors more gnan. So with respect to femtech, I think there's a lot of tech there. Okay, there is a lot of tech enabled, apps out there. There are lot many girls and women who are very excited to use them, and in different scales. But one big piece that is missing is the healthcare professionals themselves. We ourselves may be using the apps or the digital platform for a variety of things, but not so much for health. The healthcare professionals, we just took recently a survey. They haven't even heard the word femtech. They don't know what it is, and they say, oh, no, we don't believe in it. Oh, we can't even send an SMS message. Some of the senior doctors, they can't even send an SMS message. What you're talking about, chat. And oh, in the rural India, go to rural India and see, they are wiser than you. If you learn a thing or two from the drivers and the maid servants who say, ma'am, this is what I've got. And sometimes they send us the birthday messages with all the video choreographed by themselves. So they are, totally at it. They're very, very savvy. And we should use that opportunity to connect with them as healthcare professionals, to build the awareness within our own community, to not reinvent the wheel. There are so many things happening which facilitate so much of wellness aspect, preventive aspect, early health care seeking behavior, which we can guide them through the FemTech, which can also be used for capacity building, training, because we have, the training batches right across the country, from Manipur, Impal, Assam, interiors of villages in Karnataka, all 26 states we are working in. Just one more state we have to touch upon. In the local language, when we do the teaching, the staff nurses or any other healthcare providers just have to have a mobile phone, and whether they're on duty, off duty, 90 minutes they spend with us hooking onto the mobile. Even the online exams are taken onto that. So potentially, if you just start exploring how much more can be done, I think we are just now at 10%. There is a lot more to explore in this space. And I think FemTech 360 is the website that we've launched, because it's 360, entire life course. There are a lot many things FemTech can do. Also, like in the menstrual health space that we talked about, the mental health space as well. So there could be a whole band of counselors who are not available to them otherwise in their settings, but at the back end, they can connect with them and have their therapies and counseling and meditation sessions. So think of whatever, because mental well-being has become, it's really come to the forefront now. So I think right across the 360-degree life course, the FIGO wheel for wellness that we have bought in, at every touch point, there is a lot that technology can do. In fact, a new committee for FemTech has been instituted at FIGO, because it cuts across every aspect of every girl and women's lifespan whom we can touch upon. And I think you'll see a whole new era, and more so even in the low middle income countries, typically in places like India, where millions of mobile users are there. So that's all we need, and internet connectivity is amazing for a country like ours. So I think everybody is at it, and we should do more.
Just spoke about the FIGO wheel of women's health. What exactly is that? Is that a new initiative? And what does that wheel comprise of?
Actually, we kept on, talking very much about how we're missing the opportunities. Like how you said, we miss the bus. Okay, if she comes at a particular age group, we're just quick fixing her problem for what she has come. But there are so many things around that you can do at the same visit to integrate the care in that sense, and also prepare her for her next phase of life. So we thought, as a committee of FIGO Well Women Healthcare, which I was chairing, and now I'm the division director. So we said, let's put our brains together to see what a girl and a woman, 10 to 20, 20 to 30, 30 to 40, and right across her life course, what does she need? And then the concept evolved into something called Wellness on Wheels, because it's a Well Women's Healthcare and we wanted to focus on preventive care and wellness. What are the opportunities? Suppose you're trying to fix the problem of anemia in pregnancy, for example. What did you do before she became pregnant? You could have as well fixed the problem then, and then she could have embarked on the pregnancy in the pink of her health. The same way you're doing an abortion today. Safe abortion is what we are talking about. Why did the pregnancy happen in the first place? Why didn't you offer a contraceptive advice? So on working backwards, we created an entire wheel, which is the FIGO Wellness Wheel, the famous FIGO Wellness Wheel, which I'm really proud of, because it's a quick check both for the women themselves and the healthcare providers, that these are the things, touch points, need to be addressed. Maximize the opportunity when she is in the healthcare system. So that is how the wheel evolved. So when we say across the life course, there's a thing on climate change in the first place, because that's a big issue in the world. And we've also done some studies where the doctors don't know what this should mean for us and what we should be telling the patients about. What is the guidance that we have to give, like not using plastics, not using these non-stick pans with, and also the pesticides which are in question. And there are a lot many more simple things of contaminants, and what she could do in a simple way within her family to avert this. And also the pregnant women who now, the apartments on the highways, for example, there is so much dust and the environmental toxin that the women is breathing in. It's not typically about the smoking and the alcohol, the typical history we take. Where does she live? When, when people who are living in the side roads or interiors are not so much exposed to the highway kind of congested dust, and also the visits to the malls, for example, there's so much carbon dioxide in the air and there's so much happening. So, and also in the rural where, simple things like even agarbatti or the incense sticks that they use, the fragrance which comes out of that may be good, but it carries a lot of toxins. The mosquito coils, those are something that you need to be aware of, that they could be adding to the environmental toxins, for example. And then now, okay, the cooking gas has changed into a gas in many, many households, but if they cook with the charcoal and the wooden sticks, and then like a bonfire they make, and they are in a closed chamber. The houses are so small, there's no ventilation. She's engulfing everything that is happening within that chamber. So all of these practical points we have to recognize and also guide her to be aware of that and come out of it. So climate change has been given the first position in this FIGO wellness wheel because the global community recognizes that as a big problem. We're still coming to terms with that, of how FIGO will make its position statement, how it will give the guidance to the OBGYNs in general to play their roles in the climate change. Then it goes on to speak about menstrual health and hygiene, then the mental health and checking for the sexually transmitted diseases, contraception, infertility, and the issues related to that, pre-pregnancy care, and the high-risk pregnancy, how they should prevent it or tap it into it early enough so that, the best of the care can be given, and then the general wellness part of it, and the NCDs, because every other women may have hypertension or diabetes as the age advances, early detection of cancers, which is a big thing, and also FemTech playing a very big role in this space as well, for breast cancers, for mass screenings, and there is you can take the saliva of a person and then detect the cancers, for example. The new innovations are coming in, which means that anywhere and everywhere these tests could be done. So that is the importance of a mass screening and early detection. And moving on to the perimenopausal and menopausal state. So it's all the way across the life course that you can do many, many things, and immunization, nutrition not to be forgotten, because that percolates in the entire scenario with the triple burden of malnutrition, as we call it. There is underweight on one side, obesity on the other, and multiple micronutrient deficiencies sandwiched in the center. So the problems are many, but there is a way to solve them. So we say, go ahead, wellness on wheels, and we wish you the best in every phase of your life. So that is a new concept, and this similar thing is given in a, we have a younger group of gynecologists in the FIGO circles whom we have I put them on the job to make TikTok type of videos and, the social media awareness generation, because we have to talk to them without the technical jargons. We have to speak to them in the language that they understand and they can make sense out of, and typically very, very smart short clips which, remains in their head like an advertorial, for forever. So all of these, advocacy activities, and even if any young girl or a woman looks at the wheel, they can figure out all these points. They can relate to some of the touch points in their lives where they could go and ask their doctor a question or two. So it's like both sides of the coin, the demand and the supply. The quality of both should escalate to have a better world and healthier.
For instance, climate change and women's health is something that we didn't even know about. And you also spoke about menopause and perimenopause, and I think that's also something that not many women care to voice out. And now with FemTech trying to bridge that as well, I think it's brilliant.
Because I think it's a mindset that women were given to understand that they have to just go through this phase of life, come what may, they have to grin and bear it, and then nobody is anyway paying any attention, and they think that menopausal mood swings are just a part of a crankiness, and the lot of hormone changes that happen which impact the bones and the heart and the skin dryness, for example. There's a lot more to it beyond the menstrual problems which they usually come to us to fix. If it's a serious menstrual problem, then they want the uterus out, and there's a whole watch on the unnecessary hysterectomies happening in today's world. And so, there is a lot of alternatives that we can offer. But for all of that, then we need to either reach out to the women or for them to come to our doorstep, and the quality of the healthcare provision. Any which healthcare setting she goes, who are providing the healthcare? If they're basic level people, at least they should know the basic things that they have to do, and they should know their limitations as well, and they can escalate it to the next level. Because our healthcare system, from sub-centers to primary healthcare to community healthcare to district hospitals to the major public health hospitals in the metros, it's very well streamlined. People can take the same route and declutter, because many things can be solved at the primary level. But that is what is being refocused upon, both by the government and in public-private partnership with organizations like ourselves. We are trying to do a lot more, because the current scenario is that the buck is passed on, because they are not really built a capacity to offer. They don't know what is the situation and what they could do. So they don't want to take any chances, put to the next level. Like everything comes and gets jammed up in the major public health tertiary care system, where 80% of them could have been managed before they reached there. So that is, what is the change that we want to see. And the change you want to see is what is often said by the likes of Gandhi. So we say that if we want to facilitate this, then we are building a whole cadre of what we call as Swasthya Sakhis. They're wellness ambassadors. They're just people in the community, wise girls and women, who enroll into our course through ARTIST and give an online exam through the health sector skill council, HSSC as it's called, and they're certified. And they will go on a camp style, door-to-door style, on the video connect with us, and a cluster of 20 villages into one health center where these Swasthya Sakhis are placed, and we connect with them to reach the last mile. So there's a lot happening, and as I said, these things should not be one-off examples. Okay? It has to scale, and it has to reach every nook and corner. And if you really see the statistics of how many districts are there in India, in each state, and how many villages are there in each district, and if you have to say we have 2 centers, then we say we have 200 centers, we have 2,000 centers. Not enough. We have to have 60 lakh centers, because that is the scale which may make an impact. But we have to start somewhere. So we know that this is a blueprint, this is a model that is working. The Swasthya Sakhis are very happy to render the kind of services that they have been asked to render, because they feel like, very proud of the fact that they're helping somebody being well. So many women coming for their regular blood pressure checkups or blood sugar checks, height and weight, and the kind of problems that they express in these small little clinics where the Swasthya Sakhis are running, they can immediately identify what's not right and connect to the video call to the specialists in the cities. And this cannot happen without the technology. So there is, the big data there showing us what the gaps are and where we must invest our time and energies to get the population into a wellness bracket. So prevent illness and promote wellness. That is again a very, very strong concept that we are trying to drive in. And just like smart cities, we are toying with the idea of wellness villages, because we want everybody in the village to have their health records move towards the wellness bracket.
So what do you think the role of AI is? We're scared that it's going to take over the world, but with respect to healthcare, ma'am, what are your ideas around AI?
I really think it's very, very important for healthcare, because it's very complementary. Because it's often said that God can't be everywhere, so He made mothers. So specialists and doctors and healthcare providers can't pay everywhere, so he made the AI. It's like that actually, because what happens is now the AI algorithms are evolving in a much comprehensive and a sensible way. So we have tied up with an organization called IntelliHealth, where very seamlessly these Swasthya Sakhis have been given the know how to use it, and the next question is already prompted there. Then the next question comes there. So that is the power of AI. And they are also reassured that they're not missing anything. And then finally, when it comes to, it gives them a kind of a traffic signal. Every question which they've answered leads them to the green zone, then they know that they can reassure this patient and send her back. If it leads them to the amber, they know that they have to video connect with the doctor because there's something more that needs to be done for this patient. If it's red flag, then immediate emergency number is there and they have to send them, call for the ambulance and send them there. So this is great. I mean, how could you have done this manually in every nook and corner, especially the Indian role model if we create, then if it works here, it will work everywhere. And so many parts of Africa where we're constantly telling about the 3 A's. There's no access to healthcare, affordability is a problem, awareness is a problem. Okay, then create awareness, make it affordable through technology, and access is, again, the technology is the answer. How can you ensure the quality of care? It's by AI. There is a lot happening there where the machines can do better and make the humans not miss anything. So that, and also it's not only with respect to video consultation, one example which I gave, but there are a lot many more things like the breast scans, for example, the mammography scans or the pap smear, the dilemma in interpreting this. Just put it through a centralized AI. It should have seen so many thousands and it recognizes what pattern that is. So even in the remotest part, you get a quality driven report. You can't make the human errors are eliminated. So in that sense, I think it is really not going to replace us. We're not worried about that. But when it gives us the clue of what next to be done, I think that's a great step in itself. So we would love the AI to occupy the center stage.
Oh, great. That's really nice, ma'am. Because I think a lot of doctors, one of the things that they're worried about is it going to take or will it replace us? But like you rightly said, it's something that we need to leverage.
Yes.
Coming to learning amongst doctors, how important is it to stay up to date? And I think one way to do that is either you read papers on your own or you go to congresses, you attend CMEs. I've read so much and I know that you do this a lot, but it's so hard, especially for the younger doctors. What would you say, ma'am? How important is it?
Yeah, because the common phrases that we use is from policy to practice, from research to practice, from bench to bedside, because you need to get the care right there. No point in theoretically listening to things and people. And also, the thing is that it depends on the country's medical system, where at least in India, because we have a acute shortage of doctors and they have to just register themselves once, and even if they don't update, then there is no system of renewal of their licenses, for example. It just goes on and on and on and on. And now some of the government, it's a state government issue. They have made it really compulsory that within the 5 years, you have to give your medical certification for renewal, and you have to have these many credit points. So many conferences, people just attend to get the credit points, but nothing may have entered their skull. Okay, that is, and also the practicality of, actually seeing, doing, hands-on. That's why the skill transfer is so very crucial, because just by theoretically attending something, and now there are simulation-based techniques and there are master classes, there are smaller groups which we can harness through the capacity building through technology. There are learning management systems which they can hook onto and then read at their own speed and their own time. There are recorded videos. So these things are emerging in a big way, rather than going and attending a physical CME conference. And then many CPD points. Most of the global community also offers these. So those who really want to better themselves, then they have to, it has to come from within them, not just there's a whip and, the rule can be there. They can just attend. Many doctors whom we know also may just take their attendance certificate and roam around the whole city and come back again. So that doesn't work. How they're translating into practice. And I feel what would really, really work is, yes, one thing is to collect these points and renew the licenses, etc. But on the other hand, the opinions of the patients themselves, of how up to date this doctor is, because they are one up now. Okay, that is why I'm emphasizing and re-emphasizing the empowerment by educating and making the patients aware. They will ask you a question or two, and nobody should be spared, and they take two or three opinions, which is also fine. If you're sure of what you're doing, then there could be more than one opinion, and then you justify your stand, and that's what is happening. So the demand generation for the quality of care that the doctors would deliver should be, strengthened, so that then the doctors, and all these points will fall in line automatically, because they'll have to do, better than the neighboring doctor to, prove themselves. And also a lot of gap in communication skills and, making the patient understand what they're going through and why, giving them the adequate treatment options, and also expressing honestly that this facility we don't have in this center. So, this is the best for you, but I can't do it here. So maybe I will refer to another doctor. To this level, it should, actually ideally reach. Just speaking about how the doctors can upgrade, it's happening only in a very small percentage of doctors. Most of them who have started at a level of practice have kept to the same level or over the years deteriorated. That's the average. Okay. And those who are, constantly struggling to do better and better, it also depends on which part of the country they are and how much their quality is recognized. So all that is it's a complex mix, Sandhya, but I think we should make it like a quality circle, and everybody should focus on it's very abstract and intangible, the quality care. So that we must make it more and more known to people that this is what they should expect, and if they're not getting it, they should be questioning.
Have things changed over the years, ma'am, training and residency, and compared to how it was back in the day in gynecology, for instance? Has it changed?
Actually, now because of the simulation, there is a lot more of actually knowing and doing gap that is bridged, I feel. So if you really get into the right kind of course, okay, and then do it well, I think you'll be much better off and better prepared than the years in a way, because that time we used to work on volumes and just, even in medical colleges, etc., there's only so much you can do, but there is a lot more improvement in the techniques, improvement in the equipment, advancements inclusive of robotic surgery, for example, which we did not learn in the medical school. So the new technologies emerging, it requires a different and new kind of training, which there are opportunities, and from anywhere in the globe we can connect, and there are many who are eager to come and skill Indian doctors, but there are many, many, many skilled Indian doctors who are much sought after in the Western world as well. We are proud to say that, because we have, in some of the streams, we have the largest experience and complex experiences, where we are much better off than the Western counterparts who get to do very little even during their residency and training. But having said that, sticking to the protocols, standardized way of addressing the issues in a particular case, the discipline that you have to maintain, the communication and the soft skills that you have to learn, that I would any day grant it to the Western world rather than us. But we are slowly coming to terms that these are also equally, if not more important, and the grooming of our next generation of doctors is also happening accordingly, if not in the medical colleges, but at least after they pass out. There are many skill transfer courses even for that, patient facilitators and the communication skills and how to deal with how to break the bad news and how to deal with an angry patient, because violence against doctors is also becoming very, very much in the foreground now, largely because of these gaps. So everybody is recognizing that it's an important gap to be plugged in, and I think slowly and steadily we are on track on that as well.
What about work-life balance, ma'am? When it comes to that, how is it with Indian doctors and maybe doctors in the US or the UK?
Okay, there's much spoken about work-life balance in the Western world. US and UK, that is the prime. That is, that occupies a large part of their thinking, if I may say, work-life. Now, slowly, many in the next generation are thinking about work-life balance, and I want to take up this branch because then I can maintain a work-life balance. I don't want to take this because then this may not suit my time I want for myself. So it's not selfish to consider the time for yourself. It's fine, and also to balance and give time to the family, etc. But it all depends on individuals. Some who are very passionate and who want to give all the time for their profession should still be able to do it. Then they must, seek other kind of support on the home front. Okay, still have a little time for yourself, but they may want, they're passionate about something, and what gives them the best contentment and joy is at work, then they must do it. Just because they have to fit into the usual bracket of work-life balance, oh, how many days off you're taking, why didn't you go for a holiday, or why didn't you attend this family event, etc., should not be like a checkbox. It's a mix of so many things, and so it depends on what an individual wants to do, as per my opinion. But I think it's good to realize earlier in your career that you need to strike this balance, and if you need to strike this balance, then you have to work towards it. Can just not happen. And if you've taken a branch like an obstetrics and gynecology, which is a 24/7, then you've got to be available to your patients. And therefore, even within our branch, some are taking only infertility, some are taking cosmetology, the niche branches within them. Some are taking fetal medicine because they need to do only the scans at a particular scheduled hour, then they may not take in more load of patients, etc., etc. So there are branching options even within every specialty. But most of the individuals, I think now the attitudes at home have also changed. Even the partner is coming to, you know, pitch in some help at home, I suppose, even with the baby or with the household chores that a person may do. So it has to be, everybody who is in it. When the men say it's work-life balance, they can't be always enjoying the leisure time. They have to do work at home also. When the women says it's a work-life balance and that life is full of work at home, that's not the right equation, really.
I totally agree. So coming to that, what do you like to do, ma'am, when you're stressed out or when you have so many things on your plate, which I think you always do? How do you unwind?
On that. The question of when you're stressed out. Oh, when am I stressed out? So, because I only do the things that I love to do, including this podcast. So you said busy people. Only busy people make time. You will know as you go on to the further series of many, many busy people whom you might, I hope, will invite on your show, and wish you all the success in the same. But, you do the things that you like, and it's always a moment of joy. And when I'm not doing anything, I love to sleep.
That's the best.
That's
Oh, great. That's great, ma'am. So just to get to know you a little more, if you had one word that you could use to describe your 20-year-old self, what would it be?
How can you describe Hema Divakar in one word? At least I'll have to use 3. When I was 20, you could just put it squarely as serious, studious, and stubborn.
Oh, lovely. But stubbornness is so important.
Do what I want.
Yes. In medical school, ma'am, were you a first bencher or a last bencher?
I was one of the shortest in my class. by default the first bencher. But actually, in terms of activities and mischief, qualified to be the last bencher.
Oh, lovely. Oh, lovely. And can you tell us one mischievous thing that you did back then, something that comes to your mind?
Not right away, but because large part of the medical school, we remember it as how competitive it was and how we had to be really one up on the other and how we have to excel in everything that we do. And, it was one of the best of the medical colleges. So, to define, moments of mischief within that, then plenty. Because, I studied in Mumbai and, the word bindas is how in Mumbai we do whatever we want and, and the freak out types. Nothing was a bar. And then also when I moved after marriage into Bangalore, I found a lot about this gender difference. Here, many girls and women were very shy and keeping to themselves. But there was, one great opportunity in the colleges in Mumbai was like everybody on par. I was called a Madrasi because that is the only thing they knew about South Indians. And also that, whether it's the students being a mix of boys and I was the only girl in a batch of 10, which they segregate, but it made no difference at all. I think that mindset we grew up with was a great thing because back from our ivory towers, if we go into the rural and see so much of gender disparity, and even in homes irrespective of their class, there is a lot of difference between they treat the girls and the boys in their own homes, and there are many stories to tell. We didn't experience all of that, and thanks to my parents who also did not let us experience that. So in one of the preventive social medicine exams, they put two jars in front of me and asked me to identify the dal or whatever. I said, no, I don't know what this is. And I could have easily failed the exam, but then I said, no, there's no time to go into the kitchen and cook. I've been studying all the time, so don't show me all this, that kind of a thing. So it is, it's quite a challenge to play the stereotyped roles where many educated moms also will say, you need to learn all this, and they would expect you to do this, that, and the other after you get married, etc. So maybe things are slowly steadily changing, but not 40 years ago. I think what I'm mentioning was the situation which I did not experience. If I was born today, how I would have been treated, that's how I was 4 decades ago.
Oh, that's wonderful. And ma'am, what would you say you would have done if you hadn't chosen medicine? What field would you have chosen? That's a cliche question, but then what would you have chosen?
Anything, because I was not so hooked on to becoming a doctor, because it's mostly all meritorious students. Girls will go into medicine, boys will go into engineering. That till the movie Three Idiots came, that same thing stood by. Okay, so it was there were many doctors in our house. My grandfather's doctor, uncle's son's doctor. Okay, she'll also become a doctor. It was like just assumed that, but we knew that we had to get into a merit seat, if at all. If not, then I'd kept all the options open, including taking home science or Nalanda School of Arts for classical dancing or anything. But once I get into it, then I will put my heart and soul and do my best in that. That is the mindset. So, so it is okay if I was not a doctor. There are many other things that one could do in any branch, and pursuit of excellence has always been my foundation of things. Whatever you do, you have to answer yourself that you're giving it the best and doing the best you can. So that's what it is.
So I think the pursuit of excellence, it shows in everything that you're doing, ma'am. And if you had one superpower, you're a superwoman, but if you had one superpower that would help you in your day-to-day work or in your life in general, what would it be and how would you use it?
This is a question like the God gives one thing to what do you want, my devotee? Like I'm asking. No, it's a very difficult question because you can't just have one thing to do it all. You have to be humble enough to recognize that you are playing your role. The world existed even before you came, and it will continue to exist after you go. So do your best in this journey. That's about it.
Did you have a role model growing up, or who was your driving force, your guiding light?
My parents, yes, undoubtedly. Yeah.
So thank you so
And
much.
it makes me tell you that so soon we've reached the end.
Oh, I'm so glad.
Long journey, but that's what we feel always in life. That you said so much you make our place. There's a lot more to go, but the time flies. And just like how you've done, you've been wonderful, Sandhya. Because these are the opportunities for us to reflect on what we've done and whether we've been happy with what we've done. What more could we do? So you've really made me think ahead and inspired me to do a lot more. Thank you.
Thank you. I'm so glad, and thank you so much for everything that you do. So thanks a lot. It was wonderful having you here, and it was such an illuminating conversation that I had with you. I've learned so much, and yes, it's been really exciting. So thank you, ma'am. Thank you for your time.
Thank you, Sandhya.
Yes.